So you have several lymphatic organs throughout your body, and we need to discuss what they are, where they are, and what they do. So here we go. Your lymphatic organs have a well-defined anatomical site. They have connective tissue capsules that separate the lymphatic tissue from the neighboring tissue. So they are separate, their own entity. You have what are called primary lymphatic organs and secondary lymphatic organs. The primaries are your red bone marrow and your thymus. This is the site where T and B cells become immunocompetent and are able to recognize and respond to antigens. Your secondary lymphatic organs are your lymph nodes, tonsils, and spleen. They are immunocompetent cells that populate these tissues. Your red bone marrow. This is where we make our blood, right? We already know that. And it deals with immunity. It is soft and loosely organized, and it is highly vascular. It is separated from our osseous tissue by endosteum of the bone. As blood cells mature, they push their way through the reticular and endothelial cells to enter the sinus and then flow away into the bloodstream. Your thymus is a member of our endocrine system, lymphatic, and immune system. It houses the developing lymphocytes. It secretes hormones regulating their activity, and it is a bilobed organ located in the superior mediastinum between the sternum and the aortic arch. So it's just a little bit lower than your neck. And it degenerates or gets smaller as we age, which is called involution. It is a fibrous capsule, and there are these trabeculae or septa that divide the gland into several lobes. The lobes have a cortex and a medulla. The cortex being the outside, the medulla being the inside, and they are populated by T lymphocytes. You also have reticular epithelial cells that seal off the cortex from the medulla, forming blood, and this is a thymus barrier. Here we see the production of signaling molecules such as thymosin, thymopoietin, thymulin, interleukins, and interferon. You have lymph nodes. They are the most numerous of the lymphatic organs. There are about 450 in a typical young adult, and they have two functions. They cleanse the lymph, and they act as a site of T and B cell activation. They are elongated bean-shaped structures with a hilum. They are enclosed with a fibrous capsule with trabeculae that divide interior into compartments. The inside is composed of reticular fibers and reticular cells, the stroma. The parenchyma is divided into a cortex and a medulla. These are the germinal centers where the B cells multiply and differentiate into plasma cells. There are several afferent lymphatic vessels that lead into the node along its convex surface. Lymph leaves the node through 1 to 3 efferent lymphatic vessels that leave the hilum. So afferent is coming in, efferent is leaving. You have these nodes throughout your body. You have what are called cervical lymph nodes. These are deep and superficial, and they are in your neck. And they monitor the lymph coming from your head and neck. If you aren't feeling well or you have a sore throat, you may have in the past put your fingers to your neck right under like your chin almost. And if that's swollen, you say, oh gosh, my glands are swollen, right? Those are your lymph nodes. That's what you're feeling. You also have auxiliary lymph nodes, and these are concentrated in your armpit. These receive the lymph from your upper limb and from a female breast. Then you have thoracic lymph nodes. These are in the thoracic cavity, especially embedded in the mediastinum. They receive lymph from the mediastinum, the lungs, and your airways. You also have some in your abdomen. These occur in the posterior abdominopelvic wall, and they monitor the lymph from your urinary and reproductive systems. There are intestinal and mesenteric lymph nodes. These are found in the mesenteries, adjacent to the appendix and the intestines, and they monitor the lymph from your digestive tract. There are inguinal lymph nodes that you find in your groin, and they receive lymph from the entire lower limb. And then you have the popliteal, and these are in the back of your knee, and they receive lymph from the leg proper. So they all have their own location, and they are all filtering lymph from different parts of your body. When a lymph node is under challenges by an antigen, what happens? Well, I mentioned it. It may become swollen and painful because it is responding to the foreign antigen. This is what you're feeling when you feel your neck and you can tell that your gland is swollen. And a lymphadenopathy, that term is the collective term for when you have any kind of lymph node disease. So, what happens with your lymph nodes and cancer? Well, metastasis is a phenomenon in which the cancer cells break free from an original primary tumor and travel to other sites in the body to establish new tumors. It metastasizes. You may have heard that term in relation to cancer. It is not the term you want to hear. You want to hear that it's benign, meaning not spreading. If something is metastasizing, it means it is moving. So here what happens is sometimes when those cancer cells break free, they get into the lymphatic vessels. And now they can travel throughout your body. So they tend to lodge in the first lymph node that they encounter, and they can multiply there and eventually destroy that node. It may be painless, you might not even realize it, but it will make the nodes swollen and firm. And then they'd spread, like it says here, kind of downstream, meaning they just start flowing through your lymph and infecting whatever they come into contact with. So one of the treatments of breast cancer is a lumpectomy. So one of the treatments of breast cancer is a lumpectomy. No. So if you have breast cancer, you may need to have your breast removed, and a lot of times they will actually take the axillary nodes with it. Those are the ones that we find in our armpit. Because if you don't take them, and there's cancer cells in them, they may just travel to the next node. So sometimes you take not only the breast tissue, but you take the axillary lymph node as well. We also have tonsils. These are patches of lymphatic tissue located at the entrance to our pharynx. They guard against ingested or inhaled pathogens. They are covered with epithelium, and they have deep pits, which are called tonsillar crypts, and these are lined with lymphatic nodules. If you have a lot of tonsillitis, you may need a tonsillectomy, meaning if your tonsils are constantly becoming infected, they may remove them. We have three main sets of tonsils: the palatine, the lingual, and the pharyngeal. The palatine tonsils are a pair at the posterior margin of our oral cavity, and these are the most often infected. The lingual are a pair at the root of our tongue, and the pharyngeal are a single tonsil on the wall of our nasopharynx. Here is a picture of a microscopic slide. They are covered by epithelium. And as I mentioned, the pathogens can get into the tonsillar crypts and encounter the lymphocytes. Your spleen is the largest lymphatic organ. The parenchyma exhibits two types of tissue, a red pulp and a white pulp. Red pulp are sinuses filled with erythrocytes, which is why they're red, and the white pulp is filled with lymphocytes and macrophages surrounding small branches of the splenic artery. Your spleen has a couple different functions. It is blood production for a fetus, and it is a blood reservoir. It is also where the erythrocytes go to die and be disposed of. And it also is where the white pulp is monitored in the blood for foreign antigens. Your spleen is highly vascular and vulnerable to trauma and infection. And if you have a ruptured spleen, you may need a splenectomy, which means taking it out or part of it out. And that concludes our talk on the lymphatic organs.